That's right. Rolling. Here we go. Ooh.
Oh, I have that awful coffee smell, taste in my mouth. I hate that. I love coffee, I just don't like the aftertaste.
Oh, no. So tell me, what is the name of the thing that they installed in the house that you want her to fix?
They put in a Sonos, S-O-N-O-S. It was supposed to have allowed me to, like, for instance, one of the things supposed to do is allow me to play music in the theater, and it's not.
No, not here. Well, it is well soundproofed, I have to say. Anyway, we have the gym. We have this open from 6 o'clock in the morning till 2 o'clock in the morning, and students are here all the time. The only way we get to clean is if we throw everybody out for 4 hours so we can clean the place, and then they're back here at 6 in the morning.
Oh, wow.
Medical school, you don't get the summers off. I mean, this is a... We're going to take you over to the lighter side of tour. Do your magic in here, Mr. Ed. Can we, okay, can we interrupt the class? Yeah. Okay, great. You made those, Stacy Fisher.
Hi, nice to meet you. I'm just doing a tour of the school and putting it on, doing some school. Hey, we're at Touro University right here in Henderson, Nevada, and with me is former Congresswoman Shelley Berkeley, who's the CEO and provost.
Senior provost.
Senior provost of Touro University, which is essentially is a graduate school that educates doctors, nurses, physicians, assistants, educators, even camp directors, right?
Yes, yes.
A little bit of everything.
This is a pretty remarkable institution of higher learning. We are helping to educate the future healthcare providers in the state of Nevada. And in addition to that, we have a program where we help teachers that are already teaching in the Clark County School District. They want to get their master's degree, they come to Touro because of our flexible hours. Obviously, when they're teaching our kids during the day, they can't very well take classes themselves. So we try to accommodate those teachers so that they can get a master's degree and enhance their skills. So we do a lot on this campus. There's never a dull moment, that's for sure. The lobby that we just left was the entire medical school 10 years ago.
They had classes in the lobby?
Well, it wasn't configured that way, but there were classrooms there. That was the first medical class that we started 10 years ago. So we've come a long way in 10 years.
So how big is the campus now?
We have 1,400 students. We graduate 135 medical students every year. And then, of course, they go on to their residencies, and ultimately, after 3 years of residency, they go on to be doctors. Most of my medical students go on to primary care. They're family practice physicians, which we have the greatest shortage in this country, and particularly in this state, for family practice primary care physicians, and that's what Touro graduates. So we are here to fill a need and be a part of the solution to Nevada's healthcare crisis.
So do we have a lot of Nevada students at Touro University?
We have a good mix. Of course, it depends on our MCAT scores and grades before. It's very, very competitive. Last year, we had 3,197 applications for those 135 slots, so we can afford to be very, very selective in our choice. And we know not only do we have a responsibility to our students to make sure they get the best possible education, we have a responsibility to their future patients as well, to make sure that we are not only bringing in students that are destined for success, but when they graduate 4 years ago, they're going to be competent to move on to their residency programs.
You know, I know that when you left Congress and took this job, that people thought it was really a different leap, but it's not really. I mean, when you were in Congress, two really important passions were education and medical care.
And healthcare.
And here you are. I mean, did you ever think you'd be involved in the healthcare industry?
Well, no, I did not. But I have to tell you, this has been a marvelous transition because I get to concentrate on the two issues that I was very passionate about. One is healthcare and one is education. I'm helping to educate the next generation of healthcare providers for the state of Nevada because, as you know, not only are we educating future doctors, we're educating nurses, physical therapists, occupational therapists, and physician assistants as well. So we have a very robust program here, and a few years from now, when you walk into your doctor's office or your physical therapist's office, chances are they're going to be a Touro graduate.
Well, last time one of my daughters had an outpatient surgery, there were some Touro students watching and observing the procedure.
Well, I hope they watched well. Now, we just passed the library. You know, when you and I went to law school, we spent a considerable amount of time in the library, and there were thousands and thousands of volumes. Now, everything is online, and we have tens of thousands of publications that you could access just with
with your fingertips. And that's quite amazing to me, walking into a library that has no books. But that's not only the future, that's where we are now in education. So it's very, very exciting to see this, and you'll see our students, quietly doing research, but they're on their laptops, which we provide every student when they start their first day of school with a laptop that's fully loaded with all of the publications that they're going to need.
How has your experience when you're on the University Board of Regents, how has that helped you as now here at Touro University?
Well, I'm much more sympathetic to the presidents of all the schools because they were all answerable to the Board of Regents. Right. I'm answerable to a board as well. I'm tasked with doing the day-to-day heavy lifting on the campus. And as you know, I've got 2 campuses, one here in Nevada, and I'm also responsible for the Northern California campus in Vallejo, which unfortunately was very close to ground zero in the earthquake last week. And so we're dealing with that situation there. This is a great job. Every day is an adventure, and dealing with the students is fantastic. It either ages you or keeps you young. It's like having children, But it's great, and you're dealing with lives that you're going to affect in a very, very positive way. And so I'm very excited and really delighted at this opportunity to do this. And it's fun. On top of everything else, it's a lot of fun. These are, of course, our student lockers. We're heading over now to our cafeteria. We are a kosher campus because this is a Jewish-sponsored institution of higher learning. So all of the food that we serve and prepare is kosher.
Cafe Catan.
Cafe Catan. And I want to show you, I know we're going to see, but as long as we're here, let me show you something, if I may. We're going to go down over here. As I explained earlier, the lobby was our entire medical school 10 years ago, and we have expanded dramatically. But let me show you what this place looked like just a couple of years ago. Wait a minute. Can you open the door?
Oh, wow. Jeez.
This was a giant warehouse.
And this is your property, part of your campus?
Oh yeah, this is it. We're all under one roof. We've got about 60,000 square feet to expand. Amazing, isn't it? Wow. Everything that we are walking through looked just like this a few years ago. Let's do that. All right. Let me open the door. Hi, guys. All right. Okay. Okay. All right. We're walking into the research now. This is a medical school. We do a lot of research. And this is... Hi, how are you?
How are you?
Is Dr. Qureshi here by any chance?
Maybe in his office.
Okay. We do amazing research projects on obesity, asthma-related challenges that being in the desert, there's a good deal of that. The perchlorates in the water and how that affects us. HIV research as well. And so it's if we could double the capacity of this facility, we would do that. We do really great research, and our students, of course. Not only our medical students, but we have a Master's of Public Health, and part of having a Master's of Public Health is having research and having training in research, and this is where they get their training.
So when you look at the area that we just viewed, the expansion area, you anticipate just increasing the student body population?
As you know, the mission of Touro is to serve the underserved populations. The reason that the state of Nevada, Southern Nevada, was selected for a campus is because there was a physician shortage. There is a physical therapy shortage, occupational therapy, physician assistants. That's why we're here, and that's that's why those programs are created, because they're geared to helping the Nevada population overcome the challenges that we have. I am intent on creating a Psych D program. We have a tremendous shortage of psychologists in this state, and a lot of mental health issues. So I think the next big program that I am going to work to ensure that we create is our Psych D program, and I believe that not only will we do that, but that it will be very well attended once we do it. The shortage is extraordinary.
Yeah, and that whole profession has changed so dramatically. I mean, in today's world, psychiatrists do very little therapy. It's all a lot of prescribing drugs, medications.
And it would be, it would be very good to go back to, or come up with a nice balance. I mean, look, we're educating healthcare professionals for a practice in a world that we have no idea what healthcare is going to look like 5, 10 years from now. So we've got to be prepared. We have to prepare our students for any eventuality, because I don't know what their practices are going to be like. I mean, as you know, my husband's been practicing medicine for 35 years. The practice is dramatically different now than it was when he started. Now, my stepdaughter, Stephanie, Dr. Lerner, is a family practice physician. She's a DO. Larry's an MD. She, even though when she and her father get together, they talk medicine, it's the same talk. The reality is she was trained in a whole different manner than Larry is, and she is finding challenges that Larry never did, and vice versa. And so that's what our mission is.
Yeah, I think one of the important things of this university is that when somebody's ill, typically, a surgeon does their little thing, or a doctor comes in, you're in the hospital, he'll spend, 5-10 minutes with you. You're there 23 plus hours, essentially with the nurses. And it's really the
and physician
nurses
assistants
and PAs, it's really those support staff that people most interact with and most gauge the quality of their experience in medical care by the care that they've received from nurses and PAs.
That's exactly right. Look, the future of Medicare as of medicine, we know we can't foresee the future, but we know with the addition of 30 million more Americans that are going to be eligible for affordable health care, that there are not enough physicians in this country, and particularly in this state, to satisfy the need. So there's going to be a reliance more and more on nurses and more and more on physician assistants. That's who we're educating here. It's important. And this research program is spectacular, if not small, but certainly does an amazing job. And again, dealing with issues that affect the Nevada population. We have a high incidence of HIV/AIDS. We have a high incidence of asthma. We have a high incidence of obesity. That's what we're researching here. We also have a school of education that we don't talk about it enough because it's really remarkable. We educate teachers that are already teaching in the Clark County School District. They're teaching our kids, but they want to get a master's degree. They want to go up to the next level. Obviously, they can't take classes during the day. They're busy teaching our kids. So we have very flexible hours and online education. And when our teachers in the Clark County School District complete our program, they have a master's in public education. And that's good for them, and it's good for our kids as well. Okay,
Now, it looks like we're walking into an ICU or something.
Well, this is a nursing lab. As you know, we have a wonderful school of nursing, and this is where they train. Some of our robots are not looking very well, but some of them are still manual, and the other ones are automatic. So you program into this patient all of the ailments that they might have.
Symptoms.
All the symptoms, and then the students diagnose them and figure out what treatment that they would prescribe. And so this is usually, when our nurses are here, they're taking classes over there, so they have their instruction over there, and then they come over here and actually work with our patients.
So they learn how to draw blood, do IVs, administer other,
Yes. In addition to this, I mean, we could certainly use some more of the robotics, and I think this is our Mr. Robot Man. he's fortunately lost his, if you really want to make it real. But again, he's fully automated. But in addition to that, we work with UNLV's theater students, and they get trained and come in with
act like a patient.
Act like a patient with the ailments that are necessary for the students to diagnose. One of the things about having all of these health care courses and classes under the same roof is that we can do a lot of collaboration. And look, the future of healthcare, while I can't tell you what it's going to look like, there's going to be more collaboration.
And I love the fact that you have people training to be physicians alongside nurses.
Yes.
Because typically one of the complaints you always hear about how doctors mistreat or don't depend on nurses and how that relationship kind of breaks down.
Well, that relationship is changing a lot because of the differences in medicine. But if you have a physical therapist and an occupational therapist and a nurse and a doctor and a physician assistant standing around the same patient and listening to what their ailments are, the nurse might have a better suggestion than the doctor, or the PA might have a better answer for what they can do to help that patient.
Of course, as we talked about earlier, they're observing the patient for a much longer period of time than the physician is.
That's exactly right.
So communicating, that experience and how to communicate it is very important.
And and when I say in years to come, I'm talking about now, actually. When our students graduate, I mean, they're graduating with a whole different mindset than they did 20, 30 years ago, because there is that collaboration, and it's need to work together for the best interest of the patient. Until recently, that was not the case.
Because so many mistakes in hospitals are a result of the poor communication between the nurses, PAs, and the physicians.
They're going to be used to it. This is how they're learning. It'll occur to a doctor, which it never would have in the past. Look, this patient may not need a prescription. This patient may need a physical therapist. And then they contact the physical therapist, and then they can talk about what's good for the patient. I talk about the difference between MDs and DOs. And of course, we graduate doctors of osteopathic medicine here at Touro. But as I mentioned, my husband is an MD, my stepdaughter is a DO. So when I tell Larry I have a headache, he'll prescribe a medication. When I tell Stephanie I have a headache, she starts rubbing my back.
Well,
and
I was going to
both
ask
work.
you about that because, historically, I mean, osteopathic medicine developed separately.
Yes.
Right? And at one time, correct me if I'm wrong, osteopaths were not permitted to do surgery at one time.
That's correct.
They were more of a holistic physician.
Things have changed dramatically. Actually, just this year, the allopaths and the osteopaths, the governing bodies, got together and determined that the disciplines were so much alike that the residency programs, there would not be residency programs for osteopaths and residency programs for allopaths, all the same one now. And so I say that my students, the students here graduating from Touro, not only have a traditional medical school education, but they also learn manipulation. They're treating the entire body, and not the symptom, but the person.
Right. I can recall growing up, and when you thought of a DO or an osteopath, it was somebody who couldn't get into medical school.
Right.
Essentially.
Right.
That is all gone.
That is all gone.
Yeah.
It's a choice. I mean, my students tend to be very altruistic. They want to go into disadvantaged areas. That's why our mobile medical clinic has been such a great success, because they're actually training the way they want to practice. So it's a different mindset. This doesn't mean that osteopaths can't go into any specialty. They can. Most choose to do family practice, to be primary care physicians. It's a choice. When people apply, when young men and women apply to medical school now or to DO school, they're making a decision. This is what they want to do. They want to be DOs, and I think that's great.
Actually, what I see, in my observation, is that you see the medical institution and the DO institution kind of merging. Have doctors who are more traditional are becoming a little bit more holistic, and doctors who are a little more holistic or becoming a little bit more medical?
I think that's a perfect analysis. That's exactly what's happening. And look, this is an exciting time for medicine, and you've got students that are being trained, and they're going to go on and treat us for the next 20, 30, 40 years of their lives.
There's no separating out the body and the mind.
No. Although sometimes I wonder. Hi, how are you?
In keeping with what we were talking about DO education, treating the whole body, I mean, fitness, we just walked through the gym. I mean, that's an important component of healthcare.
I think you said it best. It's a combination of body and mind. You can't separate the two. Our students work very, very hard. This is a very rigorous and vigorous study for 4 years. No breaks. They don't get summers off. It's not like the old days. But if you don't keep the people physically healthy, and not only you're stimulating the mind, but you've got to keep the body working too. And I know a lot of these students, if you don't give them the opportunity to let off a little steam and exercise, all they'll do is study. And that's not a good thing either.
And then even when you go into the internships, I mean, that's even more physically grueling.
It is that. It is that. This is another area for our students to congregate, and we have 2 classrooms that can accommodate the entire 135 medical students, and so that's in there. And they're me again. Oh, yeah. Thank you. Okay.
Next step that I want you to do, go ahead and get into your groups that you did.
Get some of this.
So
Yeah.
you're on case 5. I want you on this side of the room. In the front, case 10 in the back corner.
This is our
case 7,
physical
8
therapy
here.
class, and you'll notice Dr. Fisher, she's helping train the students and giving them instruction, and then they can use the equipment to actually put in practice what they've learned. And so we like the dual ability to do this. So it's fresh in their minds, and then they practice on each other. They manipulate each other, which is very important to do.
Yeah. Sounds like one of the added benefits of going to school here.
Yeah, one would think. Stacy comes into my office every now and then, actually, to give me a little
Manipulation?
fixing. A little fixing. Let me grab her over here.
You're going to have 10 minutes to discuss your cases together collectively. And what's going to happen after that is, in order 5, 7, 8, 10, and 14, you're going to come up front and present it to the rest of the so that we can see where you're at.
And
You can make everybody feel better. I still have to hand for the exam, so don't fret at your scores. Dr. Fisher will make it okay, I promise.
Dr. Fisher, I'm so sorry to interrupt, but Ed Bernstein is here. I'm sure you all know him. He's a very prominent attorney in town. He is filming Touro for his next show, and Dr. Fisher was nice enough to let us come in here and see what you're doing.
I've never turned you away.
I know, that's true. That's true. Does anybody have any questions of Ed Bernstein? Or Ed, do you have any questions of our students?
But it's a physical therapy.
Yeah, this is actually the integumentary class, and I haven't put the gross pictures on the board because I don't want you running and screaming for my class.
Oh.
But we've been at the same synagogue for years, so thank you for what you do in this community. I really appreciate it.
Thank you. So what body part are you working on right now?
Well, I think we're going to be working on a sacrum, a hip, a shin, and what was the other one? What's called a broken down femoral to popliteal bypass for revascularization. It's pretty awful looking. If you want to see it, I've got it ready. I just haven't pulled it up.
Yeah, we'll take a quick look. Yeah,
Anybody else?
yeah, pull it up.
For me, honestly, we have gross pictures coming up next, and you can avert your eyes. But I love wound care, and I like seeing the tissue heal. So that's what we're working on specifically is just how to heal different body parts when they've been either inflicted with an injury, quite frankly, from being in a car accident or from a vehicle and they have road rash. So this is a wound care integumentary
I
glass.
have that coffee smell in my mouth.
I didn't know that we were really going to be talking about things that might
I've got it. I've got it.
as one of the prominent personal injury
Oh,
terms.
terrific. Just go ahead and we'll
Yeah.
capture a little bit of it.
Sure.
Okay, does she understand what we're saying?
So 10 minutes, guys, okay?
Okay, I'm not sure she does. No, I don't think she's going to give it to you.
Go.
Okay, I think this is what you're going to see. All right.
So she's
This is-
some stuff on the slide.
I tell you. This is our OMM lab. This is where our young medical students learn manipulation. And so we have instructors and also some DOs in the community, including my stepdaughter, that come once a week and give instruction for our students. So they learn how to kind of feel the body for what's inflamed, what hurts, and do manipulation in addition to prescribing and doing everything that a doctor would normally do. This is just an added benefit.
Okay, let's go sit down and
Yeah.
talk to Kevin.
All right. Okay, fantastic. I mean, they're learning the muscular system.
What is turning point channel
I don't know.
on the walls with different numbers?
All right. And I think we'll do the student first so he can get over to Jerry Cade's place. Great respect, because our students realize that these are their first patients. And because of the gifts that these families have given us by the donation of their loved one, our students become far better doctors because they're able to see the
Mannequins are
body.
great, but if you can't
Mannequins
work
are
on the real
great.
bodies,
I'm with
you'll
you
never
on
learn.
that.
Yeah.
I know that a lot of medical schools are going to having it very sophisticated, but having graphics and being able to peel layer upon layer of body. But from my mind, if I have a surgeon working on me, I would have liked them to have worked on a body first. I think it gives them a better understanding.
Many bodies first.
Many bodies. That's true.
So,
You had 35 cadavers that you're saying?
Correct. Yes, so we've got 34 cadavers in our large lab, and then we have a smaller lab. This large lab is used by our DO medical students, and then we've got, for our PA, PT, OT, and our Masters of Health Science programs, we have another 15 cadavers. So we get all these cadavers from other universities. We don't have our own will body donation program set up here, so we get them from UT Southwestern in Dallas, Texas, and then we also get some from Loma Linda University in California. And we keep all the cadavers for 1 year, and then at the end of the year we have them all cremated at a local funeral home, and then we get the ashes back and then give them back to the universities where we got them
And it
from.
must be a whole procedure involving transferring the body and bringing it here to the university.
Right, yeah, they ship them in each year, so we do get a new batch, a total of about 50 cadavers each year. The cadavers last that long, and they work on them throughout the whole year, but we can't really use them much more than that. So,
Right. So how do you preserve the cadaver over a year?
so they are already embalmed before they're shipped to us. Just a kind of for anatomical preservation purposes, they're embalmed a little more heavily than for like a regular cosmetic funeral style embalming, but they do last the entire year. But that's all taken care of before they come to us.
What do you think the advantages, I don't mean to take
No,
the
that's
interview,
good, yeah.
what do you think the advantages of having our students be able to work with the cadavers?
It's, especially for the medical students, it's kind of a rite of passage for them, being able to be one-on-one with a cadaver, and we tell them to treat them as their first patient, and so it's kind of a once-in-a-lifetime experience for
And
them.
how did you get interested in this job?
It just kind of, the stars aligned and I got this job. But my background's in biology, and I just love being part of the education with it. In addition to the cadavers, we try to keep up with the technology. We've got projectors on all the walls in there and a high-definition camera. We also have 40 iPads in the room. Each table of 4 students has an iPad that they use for their dissection instructions and images that they need to look at. So.
Thank you.
A lot of learning to be done, and every day is an adventure for us here.
So you didn't tell me what OM meant, or occupation, or OM?
Something manipulate,
Oh, okay.
medical manipulation. Skylar?
Figure it out.
OMM, what is it? I know.
Manipulative medicine.
There you go.
So that's where they live.
So you have 1,400 students in the student body here at Touro University, and we have a typical student, right? Kevin Ritzel. Yeah,
yes.
And I'm going to talk to Kevin, if it's okay with you, about his experience here and about, I guess he just finished some boards. that he's stressing about.
Kevin is one of our quintessential students. He is remarkable, and he's just the type of student that Touro likes to accept, and just the type of student that we're very, very proud of. And I think he is very representative of the rest of the student body.
So therefore, as a result of the magic of editing, I will go like this, and you will disappear, and Kevin will appear.
Appear right here.
Well, with me now is Kevin Ritzel, and you are, it says student doctor.
Yep, student doctor.
Student doctor. You're a
I don't
student.
have the long coat yet.
Oh, that's how you can tell,
That's
right?
how you can tell.
Right. Once you become a legitimate doctor, you have a long coat. But you're just saying you took you're a student here at Touro University, and you took some boards just yesterday.
Yesterday.
Yeah.
The bags under my eyes.
Is that? I mean, look, that's just kind of a stereotype. Is that really true?
Yeah.
A lot of work. For each-
It was what, 8.5 hours. 8.5 hour test. Yeah, that
and
was
what
fun.
was your test on yesterday?
Everything.
So
So everything from pharmaceuticals to pathology, the way that the disease happens, to all the little bugs that you can catch.
how many boards do you end up taking through your
3.
medical school career?
3. So when a doctor says, I'm board certified in X, Y, and Z, they've taken at least 3 boards. The first is taking during the first 2 are during your medical school, and the last one's during your residency.
And you're doing a residency or an internship now with?
Doing clerkships or
Clerkship.
rotations.
Okay.
Rotations.
What is that exactly? I mean, you're working with local doctors here.
Local doctors, yeah.
Yeah.
The idea is to kind of experience all the different facets of medicine, so that way you can decide which one do I want. And then you apply for whatever specialty you want, and that's where you do residency in. So, haven't
So-
quite picked yet.
You're still kind of
Still up in
on
the
the
air.
limb on this.
I kind of ruled out
Yeah.
some others too.
But we're talking about how important preventative medicine is, and you're kind of working in the AIDS world right now.
Right now, yeah. The doctor that I'm shadowing right now, he's a big HIV specialist here.
Yeah.
And it's just interesting to see that how much you can save the system money by preventing that one HIV infection too. Because these pharmaceuticals are life-saving, but they cost the system a lot of money too.
Right. And the treatment of HIV has significantly changed in the last 20 years.
Yeah. Now again, I was born in the 80s,
Right.
but yeah, apparently I've listened to these patients come in and the stories that they tell, just the way that these meds have helped them out, and the way this whole system has progressed. So, thankfully, to my preceptor who's advocated for HIV and AIDS.
Now, you're not from Nevada. You lived out of state. You kind of traveled around in different schools around the country. How did you end up at Touro University?
A couple of reasons. One is that for a medical school, I wanted an osteopathic medical school.
And why is that?
Because I used to work on the ambulances. I did 911 care for about 2 years in San Diego. And, there came a point when you're picking up an elderly patient at 4 a.m. and dragging all their belongings and their medications out with them. And what we do is on the ambulance, we have to take all the meds out. And we get the pill jars or whatever that are at these people's homes and dump it in a bag. And you're carrying this huge bag of meds out with the patient. And you know what? There came a point where I'm thinking, there's got to be another way to help people. Pharmaceuticals are absolutely important, but there are other ways of helping people too. Osteopathy allows one way. And so I wanted Touro.
Right. So you graduated with college in San Diego?
UCSD. Yeah,
UCSD.
San Diego.
Uh-huh.
Yeah.
And then,
Creighton.
okay, and then you went a terrible place to go to school.
I know, horrible weather.
Yeah. And then you went and got a master's
Yeah.
degree. Why'd you do that?
In nutrition. So I got it in, because I knew what the med school curriculum was kind of like.
Right.
And nutrition is covered very, very quickly. So I wanted to get more background on that, because it's another thing that we don't think about in healthcare too.
And how long is the program here?
The program here is 4 years. I can safely say almost all medical school programs are about 4 years. There are some in the Caribbean that I think are 3.5. But yeah, I think it's 4 years pretty much all around.
And what year are you in?
Third.
You're third. So what happens next year? Is it change? Does the program change for you next year?
You keep doing rotations, or
Right.
clerkships is the formal term now. And you do that until you go to residency. So you keep experiencing each facet of medicine.
Right.
You just keep rotating through the different facets of medicine.
So if you had to choose today, what would you choose?
Preventative.
Preventative, which really encompasses everything at some level.
I think I love doing patient care one-on-one because you get to really help a person. But if I can help push forward a policy that helps thousands of people, I'd like to do that. I'd like to spend my life doing that.
Hey, thank you, Kevin. Good luck on those boards.
Thank you, thank you, thank you.
So let me ask you this, Shelley. When we read in the paper that Nevada needs a medical school, we have something in Reno, right? A lot of people think that medical school should have been in Las Vegas instead. But we do have this existing medical school. Is there a need for both medical schools?
Well, I was a student at UNLV when the medical school was created, funded by a grant from Howard Hughes and located up on the Reno campus. And you're right, even back then, and that's got to be over 40 years ago, there were a number of people that thought that the medical school should be located down here in Las Vegas. UNR graduates about 60 medical students every year. Touro graduates about 135. Now, as you know, UNLV is my alma mater, and I am very, very close to it. Whatever works for UNLV and this community works for me. So if they want to create a medical school at UNLV to serve the people of Nevada, I'm all for it. The issue, I believe, is this. We have a serious physician shortage in the state of Nevada right now. We have medical schools right now. The problem we have is we don't have enough residency programs in the state of Nevada. Statistics show that 69% of doctors end up practicing medicine where they did their residencies. What we need to do, in addition to a new medical school, what we need to do is create these residency programs so our graduates from medical school don't have to go to other states in order to satisfy their residency requirement. You cannot practice medicine after 4 years of medical school. You need at least 3 years of residency, and if you're going to specialize, more years than that. Until we come to grips with the fact that we need residency programs, GME, graduate medical education, we are not going to add one single physician to practice here in the state of Nevada. That to me is the crisis, and it has nothing to do with a medical school at UNLV. I think it's time for a state the size and sophistication of the state of Nevada to enhance its medical education. But we also have another private school, Roseman, who is creating a medical school that's supposed to open about the same time that UNLV does. That's a private school that's not going to cost the taxpayers of the state of Nevada a penny to be graduating medical students. You will have UNLV, you already have UNR, you've got Touro. It's not a problem of medical student graduates. The problem we have, and the reason we have a physician shortage, we don't have the requisite number of residency programs that we need in order to keep our doctors here.
So how do we develop a residency program?
Well, in the past, let me say this, the cost of a residency program is not inexpensive. It costs about $100,000 a year per resident. Now, hospitals, understandably, are reticent to create these programs because they're having enough financial challenges without adding $100,000 a year. Now, as the program gets started and moves forward, they actually make money on the residency programs because you've got young doctors doctors that are practicing and billing. But until you get started, it's hard to show a profit. So the hospitals, understandably reticent to create the programs. Usually the funding to create the residency programs came from the federal government through the Medicare program. Forget that. It's not happening right now. The money is just not available. So for a state like Nevada, who has this crisis right now, we're going to have to invest in ourselves. We can talk about getting money from the feds until we're blue in the face. Nevada has the crisis. We don't have enough doctors, primary care physicians in particular, which is what Touro primarily graduates, but specialists as well. My husband, as you know, is a nephrologist. They are constantly recruiting. There are not enough nephrologists in town, and I suspect if you talk to the other specialties, they are in the same position.
So is this an issue for the legislature?
Yes, it is, and I'm very happy that the governor is very well versed on this issue. He created his GME task force. They recommended that he introduce legislation into the legislature, or propose legislation that will create a revolving fund of about $12 million so that hospitals can have the startup money that they need to create the residency programs that the state of Nevada is desperate for. So we can complain about the federal government, but we've got the crisis, and the people of the state of Nevada need to address it.
Okay, legislators, you're hearing it now from somebody who knows every aspect of it. The medical aspect, living, married to a physician, running a university, been in Congress. Get busy. Thank you very much,
Thank you, Ed. It's always
Shelley,
a pleasure.
and we'll see you next week.